Hello, welcome back. So today we're going to start with the anatomy of the duodenum, and we're going to know why we should study the anatomy of the duodenum. So at the end of this lecture, students should be able to define the duodenum, locate the duodenum, talk about the extent, the function, the parts of the duodenum, the peritoneal relations, important relations, blood supply, venous drainage, lymphatic drainage, nerve supply, and the chemical condition of the duodenum. So today we're going to start with the introduction. So what is the most important thing of the duodenum? The duodenum is the first and the shortest and widest part of the small intestine. So what they say, the duodenum is the first. So we have three parts of the small intestine: the duodenum, the jejunum, and the ileum. So the first part of this small intestine is the duodenum, and it is the shortest and the widest part of the small intestine. So this is the duodenum. So it has a C-like shape, or it is C-shaped structure, and it is approximately 25 cm in long. So the length of the duodenum is 25 cm. So it extends from the pylorus to the duodenal flexure. So here is the pylorus and here is the duodenal flexure. What is the duodenal flexure? The duodenal, from the name duodenal, it means duodenum and the jejunum. So flexure there means curve. So that point where the duodenum and the jejunum joins and curve is called the duodenal flexure, and this is the duodenal flexure. So it extends from the pylorus. Pylorus is around the stomach. So it extends from the pylorus to the duodenal flexure and lies in the epigastric and umbilical region. So the duodenum lies in the epigastric and umbilical region. So we have 9 regions of the abdominal wall, or the abdomen. So the upper and the lower part of the middle division is the epigastric and the umbilical region, and there is where you're going to find the duodenum. So it curves around the head of the pancreas. So this is the pancreas and this is the head of the pancreas. So the duodenum curves. So you see this C-like shape curve. You see this curve. So this is the head of the pancreas and this is the duodenum. So they curve around the head of the pancreas. So what is the main function of the duodenum? So the duodenum has 3 main functions. So duodenum has 3 main functions. One is they receive chyme from the stomach. So what are chyme? Chyme are partly digested food. So chyme are not food. They are just food that they are not fully digested. So that's just keeping it to your mind, or that is just the idea you have to have. Chyme are partly undigested food, and where from the stomach to the duodenum. And what's the second thing they do? They receive bile and pancreatic enzymes. Bile and pancreatic enzymes, they receive this pancreatic enzyme from the pancreatic duct, and this pancreatic duct connects. This is the relationship between the duodenum and the pancreas. So this is the pancreatic duct. So what are they doing is, through this pancreatic duct, pancreatic enzyme moves from the pancreas to the duodenum, and the third thing they do is they begins the chemical digestion and absorption. So this is where chemical digestion and absorption takes place. So where does absorption and chemical digestion of food takes place? At the duodenum. So we have parts of the duodenum. So the first part of the duodenum is the superior part, the second part is the descending part, the third part is the horizontal part, and the fourth part is the ascending part. So this is the superior part, this is the descending part, this is the horizontal part, and this is the ascending part. So let's start with the superior parts. So what is the first thing you have to know about the superior parts? Is the superior parts extends. What is the extension? It extends from the pylorus to the superior duodenal flexure. So the pylorus is related to the stomach, and the superior duodenal flexure is the curve of the duodenum. So it passes backward, upward, and to the right. So the duodenum passes backward. That is the main thing you have to know. It extends from the pylorus to the superior duodenal flexure, and the first 2 cm is intraperitoneal. So we have retroperitoneal and we have intraperitoneal. Intraperitoneal means they are covered by the peritoneum of the abdominal wall or the abdomen, Why retroperitoneal means they are not covered by the peritoneum in the abdomen. So the first 2 cm has mesentery or bulb, which allows movements. So the first 2 cm of the duodenum is what? It's mobile. Why? Because it's interperitoneum. Okay, the secret here is organs that are retroperitoneal are likely to be immobile. Why? Organs that are interperitoneal are likely to be what's mobile. So let's talk about their relationship with other organs. So the duodenum anteriorly, it's related to the lobe of the liver, and there is a fossa in the liver called the gallbladder fossa, and in this gallbladder fossa, that's where we're going to find the gallbladder. So anterior to the liver is the gallbladder. So the duodenum is related anteriorly to the liver and the gallbladder, posteriorly to the portal vein, common bile duct, and the gastroduodenal artery. And this gastroduodenal artery gives birth to pancreatical duodenal artery, which supplies the duodenum. And inferiorly is the head of the pancreas. So this is the superior part of the duodenum, and inferior to it is the head of the pancreas, and superior to it is the epiploic foramen. So what is the epiploic foramen? Epiploic foramen is a channel which allows the greater omentum to communicate to the lesser omentum. So we have the hepatoduodenal ligaments. So from the name hepatoduodenal ligaments, what are they doing? They connect the duodenum to the liver. So they are ligaments from the name hepatic and duodenum ligaments. So also have, this is the common site of the duodenal ulcer. Let's talk about the descending parts of the duodenum. So we have 4 parts. Remember, the superior, the descending, the horizontal, and the ascending parts. So we are through with the superior parts. So we are now in the descending parts. The first thing that should come into mind is it extends from the superior duodenal flexure to the inferior duodenal flexure. So this is the superior duodenal flexure, and this is the inferior duodenal flexure. Why do we say inferior and why do we say superior? Superior is above, inferior is below. Duodenal means it is related to the duodenum. Flexure means curve. So superior duodenal flexure means superior related to the duodenum, and there is a curve there. So this is the curve. So this is called superior duodenal flexure, and this is called inferior duodenal flexure, and descend vertically. So we have horizontal means this way, vertical means this way. So it descends vertically on the right side of the vertebral column, and it is retroperitoneal. All parts of the duodenum is retroperitoneal except the first 2 cm, which is intraperitoneal. So retroperitoneal means they are not covered by the peritoneum. So we have relationships with other organs. So anteriorly, they are related to the liver and the small intestine, and also the transverse colon. The transverse colon is part of the large intestine, the liver, and the small intestine. So posteriorly, it is related to the kidney and the renal vessels. Medially, it is related. Medially, this is the head of the pancreas. This is the pancreatic duct, which drains or which carries pancreatic enzyme from the pancreas to the duodenum. So we have the bile duct. Then what are the special feature of this descending part of the duodenum? The main major special feature is the major duodenal papilla and the minor duodenal papilla. So we have the major and we have the minor duodenal papilla. So the major duodenal papilla allows emptying of contents of the gallbladder into the duodenum, and the minor duodenal papilla allows, they also perform the same function, just that the minor duodenal papilla is for the accessory function, while the major duodenal papilla is for the main function. And this is the site where bile and pancreatic duct opens. So don't forget that the site where bile and pancreatic duct open, or the ample of water open, is the major duodenal papilla. So we have the horizontal part. The horizontal part extend from the inferior duodenal flexure to the left side of the third lumbar vertebrae, and direction, it passes horizontally from the right to the left. So this region is the right and this region is the left. So it moves from the right to the left. So it passes horizontally from the right to the left, and relationship, it is retroperitoneal. Don't forget, duodenum is retroperitoneal except the first 2 cm. And what are the relationship with other organs? It is related anteriorly with the superior mesenteric vessels for the horizontal parts anteriorly. For the descending parts anteriorly is the transverse colon, the liver. Why for the superior parts is not the liver and the gallbladder? Don't forget that. So we have superiorly the head of the pancreas. So superior to this region is the head of the pancreas, and posterior to it is the vena cava, the inferior vena cava, the abdominal aorta, and the right ureter. And we have syndrome. This is called the superior mesenteric artery syndrome. So when you hear the word syndrome, the first thing that should come into your mind is compression have happened in that region. So when compression happens in this region, we now have the superior mesenteric artery syndrome, whereby the superior mesenteric artery may be damaged. So we have the ascending parts. So the ascending parts extend from the left lumbar, the third lumbar vertebrae, to the duodenojejunal flexure. So the word duodenojejunal flexure, what should come into your mind? The duodenum and the jejunum. So that point where the duodenum and the jejunum meets, and that curve, that is the flexure, is called the duodenojejunal flexure, and it ascends upward and to the left. So this is the right region and this is the left region. So it ascends from the right to the left region, and what? Upward. Is moving upward. Important relationship. Anteriorly, it's related to the roots of the mesentery and the jejunum, the coils of the jejunum, and posteriorly is related to the left psoas major and the left sympathetic trunk. And there is important ligaments called the ligaments of Treves, and this ligament of Treves is used to differentiate the points of the upper and the lower GIT tract. Don't forget, the ligament of Treves separates the lower and the upper GIT tract. Keep that in your mind. Never forget that. It is very, very important, and it suspends the ascending part of the duodenum, which means it attaches it to the right cruise of the diaphragm. So let's talk about the peritoneal relationship. So in conclusion, the first part of the duodenum, which is the first 2 cm, is intraperitoneal, and any organ that is intraperitoneal is likely to be mobile. So therefore that first 2 cm is mobile. So the remaining parts of the duodenum are retroperitoneal, and when an organ is retroperitoneal, is likely to be immobile. So therefore they are fixed, so they are not mobile. So it is covered anteriorly by the peritoneum. So the duodenum is covered by the peritoneum. So let's talk about the duodenal recess. So we have 3 types of the duodenal recess. We have the superior duodenal recess, we have the inferior duodenal recess, and we have the paraduodenal recess. And in this recess, what comes into your mind is a space created by the peritoneum around the duodenum. Don't forget that, a space created by the peritoneum around the duodenum. And what can happen here? Something can happen here. Internal herniation can happen here, and when internal herniation happen here, part of the small intestine is trapped at this space. So we have the blood supply and the lymphatics. So remember, we have the arterial supply and we have the venous drainage and we have the lymphatic drainage. So the arterial supply is the superior pancreaticoduodenal artery and the inferior pancreaticoduodenal artery. They are the branch. The superior pancreaticoduodenal artery is a branch of the gastroduodenal artery, and inferior pancreaticoduodenal artery is a branch of superior mesenteric artery, and the venous drainage corresponds with the name of the arterial supply, which is the pancreaticoduodenal vein, and they drain into the portal vein and the superior mesenteric vein. So let's talk about the lymphatic drainage. So it just follows that way. What you have to remember here is the arterial supply, which is the pancreaticoduodenal artery. That is the arterial supply. So therefore the vein will be what? Pancreaticoduodenal vein. Therefore the lymphatic node or the lymphatic drainage will be what? Pancreaticoduodenal node or the pancreaticoduodenal lymph node. Or you can also say superior mesenteric lymph node, because superior mesenteric lymph node is part of the midgut. we have the sympathetic nerve supply and we have the parasympathetic nerve supply. So the sympathetic nerve supply is the celiac plexus and the parasympathetic nerve supply is the vagus nerve. So what do the sympathetic do? They are responsible for motility and secretion. They inhibit motility and secretion, while the parasympathetic stimulates or increase motility and secretion. So we have the clinical correlations. So we have so many types of correlations. So I'm going to only emphasize two, which is the superior mesenteric artery syndrome, which is what compression of the third part of the duodenum, which can lead to the compression of the superior mesenteric artery. And we have the duodenitis. So whenever you hear nitis, the first thing that should come into your mind is inflammation. So duodenitis, pancreatitis, all are just inflammation of the what? The duodenum. So I hope you enjoyed this video. Don't forget to like, subscribe, and hit the notification bell for more videos like this from Professor Learners. Goodbye.